Welcome back to MedBites. Let's learn about hepatitis B serology. This one's pretty long, but I'm going to shorten it as much as I can. So if we have the virus, this is the outer surface, and we have the core inside and the DNA here. The surface would be hepatitis B surface antigen. That's what this means. The core would be hepatitis core antigen. This only shows up when hepatocytes get infected. Only when infection occurs. And then when the virus is replicating, that's when the envelope antigens show up. So that's what these three things mean. Now, when your immune system kicks in, depending on whether you got a vaccine or whether you have an active infection, you get different antibodies. Now, the first thing you got to know is that when we have antibodies against hepatitis B surface antigens, it can either be IgM or IgG. IgM means there's an acute infection, IgG means there's a chronic infection. Antibody against HB core means that this individual had infection, and it's important to know that antibody against HBC never shows up if the person never had hepatitis B. It never shows up if no Hep B. So that means that it only shows up when they're active, when there's an actual infection going on. So let's do a couple examples. If we say that someone has surface antigens negative, antibody against the core negative, and antibodies against the surface antigen negative, what does this mean? It means that this person has never had an infection before, does not currently have an infection, and has never been immunized before, which means that they are at risk. Now, if we change these to positive and keep this as negative, what does this mean? It means that this individual had an infection before and is now immune. But the immunity is not due to a vaccine, it's due to an infection. If the core was negative and the surface antibody is positive, then that's immunity due to immunization, also known as vaccines. And that should be pretty much everything you gotta know.